Welcome to True Health Tuesdays, and the truth will set you free. Today, how to make an addict. Okay, now people have talked about the opiate. Has anyone ever heard of the opiate crisis? Yeah, it's everywhere. We're talking like 60 Minutes. We're talking, multiple things. People know that there's a drug problem out there. It's a little bit different though, because we could take it and talk about how Congress was bought off, how they fired the DEA, the Drug Enforcement Agency representative that was investigating them, how they literally monopolize our economy. But let's look at the need, okay, because the market wouldn't be there. People aren't going to be taking these things just for fun. Okay, so let's go in there. What are opiates taken for? We're talking really small percentage, maybe 2 to 3% for recreation. Okay, most people are taking it because they're hurting. So what do we got? We got a toxic deficient society that's going to a medical system that has this symptom drug philosophy. Now, you can't sue the doctor if he's prescribing correctly. So if he gives you the aspirin a day for a healthy heart, even though that's not based in science, and in fact it shows it's dangerous, but as long as he has the correct diagnosis and he prescribes it, even if you stroke out or die of gastrointestinal bleeding, he can't be sued. So we're not concerned with patient outcomes. We're concerned with getting our CYA, you know what that is? I know, in the UK, it's called cover your butt, okay? So when we look at this, what do people tell you that your symptoms are from? I just had the most bizarre conversation with one of our patients who works at Hoag, and she's had lupus for like 13 years, and we're gonna fix her. Not by treating the lupus, but by fixing the immune system, getting her body detox, dealing with the physical, chemical, and emotional stress that caused it. But she had blood clots, and I said, oh, okay, well, blood clots come from a diet high in polyunsaturated fats, extra stress, low stomach acid, and this is what caused it. And she says, well, do you know what my lupus expert doctor said at Hoag? And I said, no, what did the lupus expert at Hoag say caused the blood clots? She said, lupus. And I go, oh, how? There's no logic to this. So when we look at you're hurting, you're sick, you're deficient, you've got pain somewhere, okay? Anxiety and stress. You go up to the healthcare professional. We don't have healthcare. In this country, we have a medical reimbursement system. No one's going to follow you and say, gee, how are you pooping? How are you sleeping? How's your lifestyle? No, you got the symptom of the moment. So what do they tell you? Well, here's a short list. Hereditary, it runs in the family, I don't know. Idiopathic, that's the idiopathic. One of my wife's relatives happens to be a medical doctor, and I said, have you ever checked people that have high blood pressure if they're in a sympathetic dominant state? He says, we know the cause. The most common cause of high blood pressure is idiopathic, which means you don't know what it is. So, but you say it in Latin and you sound like you're really cool. Okay, so what does it come from? Joints just wear out? Have you heard of this? Insanity? Most symptoms are an acute manifestation of a chronic problem. Most people have a subclinical problem. They deal with the pain, they deal with this, and it's dealt with so long that eventually it affects your diet, it affects your sleep patterns, and then that affects your bowel movements, and that affects your gait, your activity level, then this affects anxiety and stress. So most of these problems, it's shoved under the rug. Why? Because the medical system isn't designed to look at health and look at what optimal health is. It's a completely dysfunctional system. No one goes in there and says, gee, your headaches, you got a 97% chance they're coming from the neck, let's check the neck. If not that, let's check the sinuses. If the sinuses are swollen, let's see why your body has excess histamines. Let's look at the overall picture, what's your physical, chemical, or emotional stress like. That's not done. That's not done. Now we know Journal of the American Medical Association. In this country, about 130,000 people every year are dying from the right drug at the right time in the right dosage. Why? Because it's a dysfunctional system. They're not looking at the cause. They're just finding a symptom. My ass is covered. You got this diagnosis. I'm going to give you this. So if you develop addiction, if you develop brain problems, you develop all of the things that this 128,000 people every year die from, okay, no doctor's going to jail for this. This is more people than are killed in most wars, okay? I mean, and this is every year. 2,500 people a week are killed. So I go to this pharmacy museum, and it was in New Orleans, and you walk in there, and it's a recreation of a pharmacy back at the turn of the century, and you see rose hips, you see oregano oil, you see all of these different plant products, and I'm going, my God, they really had good stuff. And then you see the heroin and the cocaine, and then you think, well, that's a little aggressive. But it was just the beginning of patent medicine. Patent medicine is what we call prescription medicines today. And then on the second floor, there's this poster. And it's from a Collier's expose. It used to be a magazine that they would write, very investigative journalist articles. You're not going to see this anymore because the pharmaceutical industry has bought the TV, they bought the radio, they bought the television. You're not going to see this stuff at all. Hell, they bought the Congress, and I'm going to show you that in a minute. Okay, it only costs $160 million to pass a bill. Okay, so I'm reading this, and it's hard to read the fine print, but the diseases, ague, I had to look this up. It's malaise, it's like flu. The diseases, under the disease, consumption, that's tuberculosis, cholera, cancer, paralysis, drug habits, diphtheria, etc. What are the solutions? Opium, morphine, laudanum, cannabis, heroin, cocaine, and alcohol. And you think, well, that's crazy. No, it's not crazy. Okay, if you had a cough, they would give you cough syrup with heroin in it, and it does calm the kids down. And heroin at the time, it's non-addictive. It's a natural plant product. What could possibly go wrong? I know you're thinking that opiates might suppress lung function and it's not a good idea to give to a kid, but hey, it's natural. So now they were doing this, and here's just the art. I got to read this because this was 112 years ago, and I'm asking you if things have gotten better or worse. Patent medicines are poisoning people throughout America today. Babies who cry are fed laudanum under the name of syrup. Women are led to injure themselves for life by reading in the papers about the meaning of backache. Young men and boys are robbed and contaminated by vicious criminals who lure them to their dens through seductive advertisements. My God. Okay, so now I want you to, if you haven't seen the 60-minute expose, okay, on, and this is the link to it, CBS News, ex-DE agent fueled by Congress. Joe Renazzisi, DEA agent, he's also a licensed pharmacist, and this guy started to do real investigation. He saw people dying, and he noticed that it was prescription drugs. And so he goes in to find the culprits. We're talking 200,000 people, okay, in 10 years, about 20,000 people a year. And Bill Whitaker, 60 Minutes, and I got to read this. You know the implication of what you're saying, that these big companies knew they were pumping drugs into American communities and they were killing people. Joe says, that's not an implication, that's a fact. That's exactly what they did. Exactly what they did. Now, if you go back to the hearings, okay, and I'm talking 2001, congressional hearings, Purdue Pharmaceuticals, the ones that are producing the hydrocodone, some of the opiates. And they said, look, in a properly managed patient, these are not addictive. So doctors are hearing this saying, man, this is great. Non-addictive and effective for pain. Is anyone suffering from an opioid deficiency? Is the body, see, these are the questions nobody's asking. Are these people that are hurting, did any doctor go in there and say, man, we got to find the cause of this. We got to find the physical, chemical, or emotional cause of this. Or do they just drug people because this is a psychotic system? when we look at this, okay, and this is out of the Journal of Medical Ethics, because if you're in here and you think that the medical system is based in science, that their advice is accurate, that's not affecting people, that I just put up, that the right drug at the right time and the right dosage kills 128,000 people a year. Did I just put that up? So here's a journal article from the Journal of Law and Medical Ethics, 2013. Over the past 35 years, patients have suffered largely from a hidden epidemic of side effects from drugs that usually have few offsetting benefits. The pharmaceutical industry has corrupted the practice of medicine through its influence over what drugs are developed and how they are tested and how medical knowledge is created. Since 1906, heavy commercial influence has compromised congressional legislation to protect the public from unsafe drugs. Wow. Wow. Okay, so when we look at this, and these are some of the quotes off of the site, okay, the CBS site, you're talking, they're looking at this. This investigator is finding these communities that are being destroyed. So he goes up and he tells his bosses, look, we got to go before Congress. We got to get these guys arrested. And now, aided by Congress, lobbyists and the drug distribution industry that shipped almost untracked hundreds of millions of pills to rogue pharmacies and pain clinics, providing the rocket fuel over the last 2 decades, has claimed 200,000 lives. This is an industry that allowed millions and millions of drugs to go to bad pharmacies and doctors' offices that distributed them to people who had no need for the legitimate drugs. Here's the problem. Okay, when you look at this, the need was there. The need was there. So we have a sick, deficient population and a medical system that's not based in science. If you come up to a doctor and say, gee, doc, my back is really sore. You know, I picked up luggage. Okay, is the doctor going to say, well, gee, you picked up luggage before? That's not picking up luggage. That's a normal activity. Let's do some research on this. Okay, how's your pelvis? How's your autonomic nervous system? What type of medications are you taking? How are you sleeping at night? What's your physical, chemical, emotional stress load? For God's sake, what's your diet like? Let's do an actual thorough thing. Or are they going to say, dude, we're going to start you on non-steroidal anti-inflammatories for 2 weeks course of that. If that still doesn't work for you, okay, we can do injections. I'm going to up you to hydrocodone, and that'll for sure help you. But of course, chronic pain will cause depression, so I'm going to give you an antidepressant as well. Okay, now you may have some sleep issues, so we're going to give you this Lunesta, which is really good. However, the side effect is fatigue and anxiety, so I'm going to give you a little upper too. You know, we got a little... Do you understand? This is the system that people are becoming drug addicts in. The medical system is completely dysfunctional in identifying everything. We had a patient today. She just went through a double mastectomy, chemotherapy, radiation, and the doctor said, gee, your thyroid's functioning low. No kidding. Okay, she's got systemic inflammation, multiple surgeries, multiple trauma, and you're going to compare her thyroid level with somebody who hasn't gone through this stuff. Insane. Okay, so when we look at this, it's the pain level in America hasn't increased since 1999. People are, you know, what kind of level of pain are you in? Oh, this, that scale. Yet there's been quadrupling of prescriptions. So either America is the healthiest it's ever been since 1999, or we're the most drugged the world's ever seen. Why? Because the profession that you're trusting with your health is doing damage. Now let's say that you are in pain. Let's say that you were given a prescription. Did you know that after 5 days of taking the prescription that your pain increases? That means if you're taking opioids such as codeine, oxycodone, morphine, fentanyl, okay, and we got it all in the cabinets back there from people that had given this crap up. They found that chronic pain of the morphine group worsened within just 5 days of the treatment. We found that the treatment was contributing to the problem. There's no follow-up. by God, you got pain. There's no respect for the body having an intelligent expression of these symptoms. The pain is just covered up. The symptom is just covered up. By God, you got high blood pressure. Are you drinking enough water? What's your stress level like? What's your sleep levels like? Or do they go in and say, your blood pressure's high, Bob. You need to get a diuretic, a beta blocker, an ACE inhibitor. It's true that diuretics can lead to cardiac arrhythmias and probably kill you in the end and cause damage to the kidneys. But by God, your blood pressure is going to be as normal as that guy over there. Okay. Medical overuse headache. Okay, yeah. You have a headache, you take a drug, you get another headache. Don't worry, you can take another drug. Okay, this is America. You understand they're going to play this tape 50 years from now and they'll think, nobody could have been that stupid. Okay, and I got to tell you, I was just watching the CBS interview because I didn't have a chance to see it with Joe Renazzisi, and it was sponsored by Pfizer Pharmaceutical. They come on with a 2-minute introduction, then they have a commercial. The commercial was for Chantrix, okay, a stop smoking drug, okay, because if you're on one natural drug, you want to get on the commercial drug. Okay, the side effects may be suicide, suicidal thoughts, more infections, everything else. Then Joe comes on to talk about how the pharmaceutical industry is poisoning America. Okay, wound repair. If you're going to take an opiate for actual pain, you've got surgery, motorcycle, big trauma. Okay, published in Wound Repair and Regeneration, the data suggests that opioid exposure can reduce the likelihood of healing in patients with chronic wound. Why is that? Okay, when you look at inflammation, inflammation is a repair process. It's how the body regenerates tissue. So if you have itis, arthritis, if you have inflammation of anything, that's the body doing everything it can to heal. So you don't take a drug to make you comfortable that stops the healing process. You take things that capitalize on that inflammatory process so your body can regenerate tissue. Approximately 6.5 million people in the U.S. experience chronic wounds. Chronic wounds. So why would that be? Why don't we go in there and look at the biomechanics? How about stabilize? Why? Because we've got one system in this country that's completely dysfunctional, workman's comp. We actually had a workman's comp supervisor come here the other day that brings his wife, and I said, boy, that's a horrible system you're working for. Let me tell you, workman's compensation, if you hurt a leg, okay, at work, do you think if I'm walking around like this for a week that this could negatively affect my pelvis? Yeah? Do you think it might negatively affect my shoulder? Yeah. Guess what? In work comp, you can't fix the whole body. You got to work on just the side of the injury. That's really smart. Okay? Okay, so overscribing opioids for chronic pain is driving the epidemic. Okay, so what are some of the effects of these opioids? I mean, we know constipation. Oh, I just saw a drug for opioid constipation. Honest to God, okay? Okay, dry mouth, upset stomach, lung and heart problems, sleep apnea. And remember, these things, this is the short list. We're not talking addiction and just literal damage. So what's the other thing? Okay, so you go to the doctor, let's just say for back pain, neck pain, arm pain. Bam, you get a course of nonsteroidal anti-inflammatories. It's true. The ibuprofen, Motrin, and Aleve, the nonsteroidal anti-inflammatories, destroy joint cartilage, okay? So you can't be on that for too terribly long, plus it causes damage to all the organ systems. Bam, you might be given the opioids right away, or they give you cortisone shots in the joints. That doesn't work either, because no one's suffering from cortisone deficiency. There's no respect for the body's processes. You understand this? You got pain, there's a friggin' problem! Okay, but you're gonna drug the symptoms. Okay, this does not make sense. Okay, in human world. Okay, so now the drugs don't work because you're not suffering from drug deficiency. The shots don't work because that doesn't work. The cortisone starts to destroy the joints. So let's go to surgery. This is a great book. Surgery, the ultimate placebo. Okay, so now, but before I read a quote from this book, understand the vet task force went and looked at the medical system And they say, at best, the advice you're getting from the medical system is right about 20% of the time. It usually averages around 4%. If you read that backwards, if you're abdicating authority over your health and you're going to the medical system that's run by the pharmaceutical industry that now controls our government, they're wrong 80 to 96% of the time. Okay? There's very little evidence that spine fusion surgery for back pain is effective. It's very expensive. Implants alone cost tens of thousands of dollars, leading to complications that require further surgery, and an increased mortality often does not even result in the spine being fused. The rate of spinal fusion surgery is increasing, has been increasing many years. The rate in the US has gone way past one spinal fusion per 1,000 population per year. It's overtaken hip replacements. Okay, why? Because the system is completely dysfunctional. Let's just look at back pain. Just look at it, okay? Chronic low back pain is the CLBP, although there are multiple surgical options. Anyone in here suffering from lack of surgery? No. Anybody actually have one disc that's bad, not affecting the ones above or below it? If anyone knows anatomy or physiology, you're going, that was the funniest joke Bergman ever said. You can't have one disc, they're all connected. Good one. Okay, so it doesn't work that way. There's something wrong. There's loss of curve, buckling of the spine, abnormal gait, abnormal mechanics. There needs to be some research, some in-depth appreciation that the body has actual problems. Okay, not suffering from drugs and surgery. Lumbar fusion for common degenerative changes appear to offer limited relative benefits, if any. So the surgery doesn't work, the drugs don't work, okay? The chances of permanent disability increase 500% with surgery compared to no surgery. Let's look at muscle relaxants, because remember, you're going up to this trusted healthcare profession that kills 128,000 people a year with the right drug at the right time and the right dosage. If a mechanic had this record, would you take your car to him? No, would you let him fix your toaster? Okay, so now you go to this medical profession, you got the back pain, the steroids didn't work, the anti-inflammatories didn't work. What's he going to suggest? Let's go to the physical therapist. I got an idea. Let's try muscle relaxants first, okay? Now, muscle relaxants don't work on the actual muscle. They attack the central nervous system, okay? So now, for every 1 inch that heads forward, the pressure on the disc double. Is the body smart or stupid? The doctor's smarter than your body, because I'm going to give you a muscle relaxant. By God, we're going to relax those damn muscles because they're spasming out for the hell of it. Do you see the arrogance and ignorance? Okay, for every 1 inch that heads forward, the pressure on the disc double. That means these muscles are screaming. So if you relax those, that head's going to fall further forward. The muscles on either side of the spine, you don't even have conscious control over. They increase in tone under proprioception, your brain's awareness, or actual nerve pressure. It's foolish to relax those muscles. But let's look at what the Journal of Spine says. Studies do not provide evidence for long-term use of muscle relaxants. Muscle relaxants demonstrated more central nervous system side effects. No kidding. It's a central nervous system toxin. Okay? Sudden discontinued chronic use of benzodiazepams is associated with delirium tremens, where abruptly discontinuing baclofen may result in seizures. So if you are taking the central nervous system poison to relax those guarding muscle spasms, which is an intelligent response in your body, stopping those abruptly can result in seizures and craziness, delirium. Who prescribed that? Okay. Electric modalities are frequently used in the management of chronic low back pain. However, few studies support their use. Okay, interferential current. Now, I used to be the tutor for the physical therapy lab. Okay, so I know about interferential. Okay, we know about low volt DC. We know about all the different therapies. Okay, and in 22 years of practice, I never wanted to go out and get an ultrasound machine. I never found it necessary. I never got a muscle, stimulation electric machine. But now let's look at what the Journal of Spine has to say. Interferential current, no eligible studies found. Electric muscle stim, no eligible studies found. Ultrasound, no eligible studies found. Hot pack, ice pack, cold pack, no eligible studies found that are effective. So let's look at the real problem. Okay, obviously the medical system, if you go there with a common symptom such as neck pain, back pain, arm, hand numbness, whatever, foot pain, knee pain, joint pain, shoulder pain, whatever, if they treat it with a drug or surgery or electric stim, and they're not looking at the overall body. Has anyone ever woken up here with a sore shoulder and think it's only the shoulder? It could be. It could be. You're laying in there in bed all nice and neat. Your ex-spouse comes up and beats you in the shoulder. That's possible. The rest of your body is nice and stable. Your head's all comfortable. Only the shoulder was injured in that. If that scenario happened, you're unique. Most people who have a neck problem, a shoulder, but a thorax, there's going to be some kind of source. Does that make more sense? Let's look at inflammatory diseases. Alzheimer's, because that's what the population is. What we've got a sick, toxic, deficient population. We've got poison that we're feeding our system. We're not moving our bodies. And inflammation is how the body heals. So when you look at this inflammatory diseases, think that the body is damaged. And inflammation is how the body's healing. So when you have Alzheimer's, we've got plaquing in the brain. What's that plaquing in the brain come from? Okay, it's from a long-term toxic, deficient lifestyle. And by God, the body is trying to regenerate the brain, but it can't because it's in a stress state and it can't break those proteins to amino acids. And then what happens? Autism, toxic deficient, asthma, depression, aging, strokes. This is not, the standard diseases. These are the body breaking down. Okay, let's look at acetaminophen, Tylenol, the most number one prescribed. Acetaminophen decreases intracellular glutathione levels. Okay, what this means, glutathione is protective of the brain, it's protective of the body, and acetaminophen destroys it. It impairs endogenous antioxidant defenses and may have a role in pathogenesis of a number of inflammatory pulmonary diseases, including asthma. So wait a second. The number one prescribed drug in America, acetaminophen, okay, will stop inflammation and promote inflammatory diseases. Let's look at clinical biochemistry. If you have anything, oxidative stress is an important factor in the pathogenesis of celiac disease. So if you're taking a Tylenol and you start to develop celiac disease, is it only from bad wheat products or bad digestion? Or could it be from a toxic deficient lifestyle? What is what is glutathione? It's a master antioxidant. It detoxifies the system. It's brilliant. But what do the doctors say when you get a vaccine? If your child has a fever, give them Tylenol. That depletes glutathione, and this is what protects their brain. I'm not anti-drug. I'm anti-stupid. Okay? Garlic, onions, this is vital. Tylenol, the number one drug prescribed in the country. This is not the opioid epidemic. Dulled emotion responses, increased asthma risk, blood cancers, decreased cartilage production. 61,000 people a year, according to the Journal of the American Medical Association, develop drug-induced Parkinson's symptoms. Chronic pain changes brain structure. This is the biggest thing ever. What I want you to own is the body is intelligent. Its responses to the environment are intelligent. If you cover up the symptom with a medication, unless it's very short term, like if you've been run over by a car, and I'm going to tell you personal experience, that hurts, okay? Morphine is appropriate for the first couple of days because it feels better, okay? If you've had a chronic illness, pain, whatever, sometimes these chronic drugs are necessary for a quality of life, absolutely. But those 128,000 people a year that die from the right drug at the right time, did they have a good quality of life? No. There has to be more thought in this. Chronic pain shrinks your brain. So if you're under pain day in, day out, 6 months of chronic pain shrinks your brain equivalent to 10 to 20 years. So listen to the body, respect the body. Find the source of it. Find a real doctor that's going to do an entire thorough checkup. Okay? The longer a person has chronic pain, the more their brain shrinks. And this doesn't mean that opiates are going to make your brain grow. Okay? It just means your brain is still going to shrink, but you're not going to really care because you're stoned. It's important to emphasize the importance of treating pain early and aggressively, or it will destroy their brain. I have a major problem with this. Treating pain? That's idiots. Treating the source of why your body is presenting with this inflammatory response and this massive discomfort. Absolutely, I'd get behind that 100%. You don't treat a symptom. That's insane. They came up with this really good article and a great idea. Non-steroidal anti-inflammatories may prevent Alzheimer's. Sounds good, right? Yeah, they did the study. Bummer. Okay. Contrary to the hypothesis that non-steroidal anti-inflammatories protect against Alzheimer's disease, pharmacy defined non-steroidal anti-inflammatories as heavy users increased dementia. Heavy users is like 1 a day. Okay, increased dementia of Alzheimer's disease and dementia, 66%. So it turns out that it's not good for you. Vioxx. Anybody ever hear of Vioxx? Amazing. When you look at the original articles on Vioxx, and they're comparing Vioxx with a placebo, this was a quote from the original journal article. The overall mortality rate and the death rate from cardiovascular disease were similar in the two groups, the Vioxx and the placebo. However, after a couple of years on the market, because I think it started in 1999, it was approved. It was pulled off in 2004 after 27,000 people died of heart attacks. They say up to 100,000 people are dead now. Some people are up to like 200,000 or 300,000 people. Nobody went to jail. Why? Because it was the right drug at the right time and the right dosage. And don't worry about the company that made it. Okay, they made almost $4 billion. Okay, what does pain do? Does pain elevate blood pressure? Yeah. Does pain elevate cholesterol? Does pain elevate blood sugar? Absolutely. So these people walking around with high blood pressure, could they have a subclinical presentation of pain? Or could they be so used to chronic pain that that's how it's presenting? So if the doctors look at your physiology, your vital signs, and they say, wow, your body has high blood pressure, take this. Your body has high cholesterol, take this. Your body is, you're pre-diabetic, you need this. Okay, pre-this. Okay, when you look at this, it's nuts. These are all signs of chronic stress. The autonomic nervous system is going to respond correctly given that physical, chemical, or emotional stress. Correctly. This is a cool picture out of a book, but it shows the nervous system actually attaching to the immune system cells, macrophages. That means your brain, that nervous system, that autonomic nervous system, this autonomic nervous system that controls and coordinates every function of the body is directly linked to your immune system. So chronic pain not only shrinks the brain, it will weaken your immune system response. Now, at the time Vioxx was really popular, they compared Vioxx with chiropractic. Now, I know chiropractic's scary for a lot of people because we bring the body up to normal function and it's non-toxic and non-addictive. Yeah, you're addicted. Yeah, you're married to the chiropractor. Okay, so so when you look at this, they compared it and they stopped the course of chiropractic care, and for 18 months, the chiropractic group was working good. They had to stop the study because Vioxx was pulled from the market, and it was kind of mean beating up drug companies after they've already killed 100,000 people. Okay, but this one, it turns out the chiropractic adjustments, why am I putting this up there? Well, for one, I'm a chiropractor, but also we're getting the nervous system to work correctly. You get the body to work correctly, will it affect the brain in a positive response? Absolutely. Chronic pain, does that positively affect the brain or negatively affect the brain? It negatively affects it. This is a perfect example. Ex-vet comes in, and I think he tours of duty in Afghanistan. He was taking antidepressants, anxiety, courses of antibiotics. I mean, he was a drug nightmare. Okay, you're looking at physical stress here. Did he have emotional stress too? How's his sleep patterns? What we did, we got him on healthy nutrients. We got him pooping 3 times a day. We got him sleeping. We got him reprogramming his brain with the neurolinguistic programming. We got him out of the physical, chemical, and emotional stress. That's what doctors need to do. You get people that have had physical, chemical, and emotional stress. If you don't hit all 3 of those, you're not going to get the person better. These are anti-inflammatories, because remember, inflammation is how the body heals. The reason people promote natural fruits and vegetables as anti-inflammatories is because when inflammation happens, you create free radicals. That happens in the breakdown of tissue. These free radicals can actually attach to healthy cells and damage them. So what anti-inflammatories do, they have extra electrons that deactivate those free radicals. So this actually helps your body with that inflammatory process to regenerate tissue. I mean, it just makes sense. Cayenne pepper is a good anti-inflammatory. This one, kratom, and it's just a plant. Okay, it's similar to coffee, but the FDA is trying to outlaw it because it's natural and safe and non-addictive. The FDA is trying to outlaw it because it's natural, safe, and non-addictive. Should I also say it's not patentable too? Okay, yeah, they're trying to put it as a class-run drug. Yeah, when coffee is outlawed, only outlaws will have coffee. Okay, but look at all the other things that you can do. You know, water, breathing, I mean, fish oils, omega-3s. There's so many lists that you can do, and this is just a short list, but literally, instead of taking something for pain, you're just a glorified allopath. If you take something that your body's deficient in, or you take something to detox your system, and you actually look at the intelligence of what your body is responding to, your body's going to be healthy. So let's take away the psychotic medical system that created this opioid epidemic by teaching our young people that are doctors that really care for people. Okay, but their hands are strapped because they're not taught that the body's intelligent. It's the whole education system. This is what you need to get your body healthy, organic, healthy fats, plant-based diet, juicing, blending, proper nerve supply, exercise, sleep. I mean, this is all the solutions. Now, we've got Extreme Health Academy. We've got webinars like this all the time. Okay, I think weekly, monthly, something like that. I don't know, I'm always doing something for them. Okay, I really don't know. My team tells me I got to go here and there, but this is really popular. And then check out our site. This is becoming one of the most powerful natural sites on the planet. Now, any questions? I got to repeat the question. So if anybody asks something, make sure it's short and sweet, and we only have 5 minutes of it, so no long questions.
I have a question.
Yes, ma'am.
Okay, someone with back injury, chronic pain, 20 years, on opioids. They never prescribe just opioids. There's the muscle relaxant and the Lyrica. How does a person come back from something like that?
Okay, perfect. A person, 20 years of back pain, prescribed muscle relaxants, pain relievers, and Lyrica. How does a person come back from that? Easy. Don't take 2 drugs together. Separate them by at least an hour. That's going to detox it. Then they got to go to a corrective chiropractor to do this. Get their nervous system checked. You're going to check the stress x-rays, find out what's going on, even if somebody's had surgery, because we know surgery isn't effective either. You're talking a massive re-upping of more surgeries. So you got to take stress x-rays. You've got to stabilize the pelvis. Look at our pelvic health video. So you got to get the trochanter support in there. You got to make sure the person's sleeping. You got to restore. And remember, 50% of low back issues are also coming from the neck. So when you're looking at the site of injury, you got to look at the entire body. Do you think we need to take a look at their biomechanics of how they walk, how their feet are? Do you think their feet are going to be flat by now with bunion formation? Yeah, their whole gait's going to be off. So we've got to check the physical, chemical, and emotional stress, and their body's alive. Discs are alive. If you cause an inflammation at the disc, you're going to correctly cause an inflammation at the disc. Why would I say that? Because inflammation's how the body what? heals. God, I feel so heard. It's true. So you get their body to heal. Okay, and then you develop a dialogue with the guy that prescribed the drugs who's working with a completely dysfunctional system. He's unaware that discs can regenerate. He hasn't a clue to check the pelvis or the neck or the gait or the sleep or the bowel movements or anything else. He doesn't know. He wasn't trained in this. He's trained symptom drug, and that kills a lot of people. You go in and explain this, develop a dialogue, then get him to juice and blend every day, which has anti-inflammatories, which will help him. It's going to start to clean his blood. It's going to get his lungs working correctly so it can detox and get rid of the carbon dioxide. You walk him through, get him up to 2 to 3 bowel movements a day. And then, because sick people need drugs, what happens if we take a healthy person in this room and we give them the oxycodone, we give them the Lyrica, and we give them the baclofen, the muscle relaxant? Let's just pick a random person. No, they would get sick? The toxins will go up, they get sick. Okay, yeah. So if we're getting this guy healthy and he's taking those drugs, he's going to remain sick. And so once you understand that, because there's a dependency, you know, these drugs are keeping them alive. No, they're not. It's increasing the pain. It's keeping them sick, okay, because the real cause has never been addressed. Yeah, he'll get better, 100%.
Is there a point of no return from 20 or 30 years of damage caused by the drug?
Is there a point of no return for 20 to 30 years of damage caused by the drug? Yeah, it's called dead. If they're alive, and I'm talking quadriplegics, bullet wounds, I've seen every possible injury you could imagine. Okay, double amputee from infections, we're talking 32 prescriptions in one human being. I mean, everything that you could imagine, bone cancer, multiple fractures. I mean, everything comes in, every kind of chronic toxicity or deficiency in 20 years of everybody comes in our doors, okay? And as long as they're alive, the body is self-healing and self-regulating. You change that dialogue, okay, then they understand that the result of a toxic deficient lifestyle is what they're experiencing. And you change that, the body is always self-healing and self-regenerating. Yeah, I got a lot of faith in humans. I got zip faith in patent pharmaceuticals. Unless it's short term and you were just hit by a car. And man, 2 days of morphine, do me up, right? Okay. Yes, ma'am.
50-something-year-old about to undergo surgery for cervical stenosis. Is that going to be the answer?
Okay, a 50-something-year-old is going to go under spinal surgery for stenosis. Is surgery the answer? I don't know. It totally depends. If that person was involved in a crush injury that crushed the vertebrae, that destroyed everything, absolutely, surgery is completely appropriate. If that person has a reverse curve in the neck that's causing stenosis, then surgery is completely inappropriate if those joints move. You got to restore the curve, and that eliminates the stenosis. So you have to do an accurate assessment using stress x-rays and correct the stenosis. Correct the stenosis. Stenosis can be reversed. Stenosis can be reversed.
Well, it started with him dragging one part of the leg.
No, ma'am. Okay, wait, hold on, because I got to repeat everything that you say, so this better not be a dialogue. You better ask a question, then I'm going to answer it. Okay? Okay. So what she just said, it started with him dragging the leg. Anybody believe that? No. Raise your hand. I'm going to, no. Did it start with him dragging the leg? No. The nerve compression was there for a long time. He had an altered gait for a long time, many years. His pain was in chronic physical, chemical, or emotional stress for years. Everybody understands that. The doctor doesn't. Gee, Bob, your leg is dragging. You got nerve compression. Let's lay you down and get an MRI. Oh, yep, shows stenosis. Of course, we're not going to check anything but the site of injury. We're not going to look at your gait. We're not going to see how your physiology is. We're not going to ask you about your drug use and history. We're not going to see if you were taking years of non-steroidal anti-inflammatories, which destroy proteoglycan, which is the building block of cartilage. I'm not going to ask you about your history. I'm not going to ask you how you move. Do you sleep on your back with both your legs bent and a pillow underneath? That flattens out the disc. That could make a stenosis appear on an MRI. We're not going to ask about that. You're just dragging your leg. It's a damn leg. Hell, I'd amputate the leg. Cut off the offending part. You understand? It's crazy, crazy. They have to respect the body. And since the body started to deteriorate and compress, the body can regenerate, okay, and regrow. Okay, there's not that respect to the body.
How do we get a consultation with you?
How do you get a consultation with me? Talk to the girls.
Get in line.
Hold. Yes, ma'am, way back there.
You said it is not right to relax the muscles when they are tight. So
No. Okay, because remember, I got the mic. I got to repeat everything you say. Okay, let's make it easy on me, because I'm not that pleasant. I've been up since 4. Okay, this is my fast day, so I'm ready to chew my arm. Okay, so I say it's not right to relax the muscle. No, I say you got to find out why the muscle's tight. Okay, you find out why the muscle's tight, then you know whether you should relax it or not.
So I'm having a lot of muscle cramps at night, and it's horrible when it catches you. It's like
Okay,
what I would use magnesium or magnesium spray.
Okay, I had muscle cramps at night and I used magnesium and magnesium spray. That makes sense. So it was magnesium deficiency, which is one of the most common elements that our diets are deficient in.
Stop immediately.
Yeah, that makes sense. Okay. Yes, ma'am.
I read that acupuncture can not only balance energy but raise serotonin, which then eases the pain. Is there another possibility without needles to raise serotonin?
Okay. I read that acupuncture was good at raising serotonin levels and easing pain. Again, I'd go back. Why was the pain there? Okay, acupuncture is not drugless and effective. I'm in total agreement with that. Okay, but why is the pain there? Find the source of the pain and then fix it. Okay, and next week, I don't know what we're talking about, but we will. It's going to be something cool. Thank you very much.